One common question that we get as a pediatrician is, when do you bring your child into the doctor when they're sick? And that could be cough, cold, flu, any of those symptoms. Our common advice, or our advice, is usually to bring the child in when they have had fevers for more than 2 days, fevers above 102 degrees, pretty consistently. If there's any concerns about intake, dehydration, or any signs that they're working harder to breathe. So if you see the skin between their ribs pulling in as they're breathing, or if you have any concerns about that, then we recommend that you bring your child in to be evaluated. As far as dehydration goes, the best indicator, at least in the young children that are wearing diapers, is how many wet diapers they're having in a 24-hour period. So we usually say, if it's less than 3 in a 24-hour period, the child should be evaluated for dehydration. More than that, generally they are doing well enough with their intake that they can maintain their hydration status. Older kids, it's a little bit harder, but you get an idea of how often they're going to the bathroom. So if they're going less than 3 times in a 24-hour period, they should be evaluated as well. So as far as diarrhea goes, the number of stools isn't really as important as, are they taking in fluids to keep themselves hydrated. The biggest risk with diarrhea is actually diaper rashes from scalding the skin from the acid that comes through with the stool. So using a good barrier cream with anybody having diarrhea is going to be helpful to prevent that diaper rash. So if you have any concerns about your kids being sick and needing to be seen, or just want to talk with one of the nurses, that's the best place to start. So giving our pediatrics number a call, 515-875-9420. That will get through to our nurses quickly, and we can answer those questions. You can call the same number after hours, and our after hours nurse triage center can help answer questions and then get to the doctor on call if needed. When in doubt, be seen. After hours, you can call and we can give you some advice if we feel like ER is necessary, but urgent care is always an option as well. My approach to care is, regardless of the age of the patient that I'm seeing, since I do see all ages, is to involve the patient in the decision making, but also the family if that's appropriate. I think it's important that everybody knows what's going on and be involved in the decision making. What I love about what I do is, especially when I can take care of the entire family, I can take care of grandma, grandpa, mom, dad, and the kids. It's great getting to know everybody, because that also helps kind of in my decision making in terms of what we should do for care.